So let's talk just briefly about cognitive behavioral therapy. I feel like could probably spend like a whole hour just talking about this because it's kind of a big topic. But this is an evidence-based therapy approach that and there's lots of like books out there and stuff that you could read. It's something that you could teach yourself sort of the basic tenets of. There's kind of a lot to it, so it probably goes a little bit better if you sort of have a professional sort of guiding you along the way. But I think some of the general tenets of this approach are easy to use and kind of easy to understand. But cognitive behavioral therapy, or CBT, is very structured. It's a brief therapy approach, time limited, so usually about 8 to 12 sessions is how we deliver it. And it's usually very focused on what's happening currently, what the current behavior is, not necessarily like this happened, a long time ago. It's really focused on the here and the now. And it's been shown to be really helpful in treating anxiety disorders, insomnia, depression, eating disorders, chronic pain. Super helpful approach. So this triangle here is sort of the basic understanding of what CBT is. So the philosophy behind CBT is that our thoughts and our feelings and our behaviors are all connected to each other. So if you want to change how you feel, if you want to change your mood, change your anxiety, you have to intervene at the thought or the behavior level. So the idea is change the thinking, change the behavior, you have an impact on the emotion. So an example might be, standing up here right now, I may start thinking to myself like, oh my goodness, this is streaming live, like all these people out there are listening to me. That's actually making me really nervous. And I might notice my anxiety start to increase. So, okay, I need to change that. So I can either change the thinking process. So that thinking process of like everybody who's streaming in right now is critiquing what I'm wearing and not listening and thinking, oh, she doesn't know what she's talking about. Okay, so those thoughts aren't very helpful. They're making me feel more anxious. So how can I change the thought? And it's not necessarily that I have to change the thought to be 100% positive, but just change it enough to be realistic, which is I'm doing the best I can. I think people who are streaming in are hopefully learning something and taking something from this, and it's going to be fine. And even if somebody at home isn't paying attention or whatever, it's okay. It's not the end of the world. Or I can change the behavior. So it's kind of hard in the moment, but if I was feeling like my anxiety was really surging right now, I might just need to take a deep breath and sort of get my breathing under control, take a second to reset, and then get back into it. So change my behavior. So I can either change the thinking process or change the behavior and get an impact on how I feel. And that is sort of the basics of CBT. That's a really, really short synopsis, but a lot of times it's important to just stop and think, okay, am I thinking about this realistically, or am I jumping to conclusions? Am I blowing it out of proportion? Am I seeing it in like all or nothing kind of black and white terms? How can I find a balance in my thinking? Or do I need to do something different? Do I need to act differently to have an impact on, on my mood or on my anxiety or on my sleep problems? So that's like tip of the iceberg CBT, but it can be helpful to just occasionally remind yourself to check in on how your thinking is or what you're doing to try to help feel better.